We're live.
Hi, Dr. Moya here, Lewisburg Plastic Surgery. We're glad you could join us live here on Facebook. We are going to inject some Botox cosmetic into our willing participant here. She's one of our great OR staff nurses. And we're going to go through this so you can get an idea how simple this is as a treatment to eliminate some of those pesky frown lines on your face. And let me show you, this is an ice pack that we use to cool the area. It helps numb the area, but it also helps constrict little blood vessels so we can kind of limit the bruising. So Botox cosmetic is used very commonly. It's the most common injection performed in the United States. And the areas that are most commonly injected are the frown lines, the number 11s between the eyebrows. We can also inject forehead furrows, and we can also inject the squint lines. And what we're trying to do is weaken the muscles that actually cause these lines. We don't paralyze the muscle, we just weaken it just enough so we get a nice effect. So in this instance, we're going to show you the most common area, which is the number 11s, the frown lines, and we have different dosages that we use, different areas that we inject, all depending upon what the patient needs. So Marianne here, I'm going to ask her to frown for me, Marianne, and as she frowns, relax for a minute, frown again. We can kind of see the muscles working here, here, and here. There's 3 muscles that we're going to inject that actually cause these lines here and across the nose. So I'm going to target that with a specific amount of Botox, and I'm going to use 5 standard injections so that these lines will disappear. It'll take anywhere from a week to 3 weeks for the Botox to really kick in and to really see an effect in regards to these wrinkles fading. You'll get a full effect at about a month, and the Botox usually lasts about 3 to 4 months. A lot of patients tend to come in around 3 to 4 months so that they can keep those lines at bay. That's one way of doing it. We do have patients that they like the result of the Botox, but maybe they don't want to come in every 3 to 4 months for financial reasons, so they might come in just before a special event, a reunion, a birthday party. We usually recommend that you come in at least 2 to 3 weeks before the event so that there's less chance of maybe having a little bruise. So why don't we get started? Are you okay, Marianne?
I'm great.
Have you had Botox before?
Yes, I have.
Okay, so you kind of know what to expect. Mm-hmm. So what I'm going to have Marianne do is, again, just put a little bit of the cool pack on here just to get that a little cold. And what's nice about this is this is one of our little cold packs that you can take home with you. Nice little souvenir, and you can use it on your elbow, knee, and it's nice advertisement because it says Lewisburg Plastic Surgery on it. So I think that's pretty good. Pretty cold right there. What do you think?
Mm-hmm. It's good.
Okay. So we'll put that aside. We're obviously going to make everything nice and clean here. So we'll have a little alcohol swab that we're going to clean the skin up with. And we have our Botox already drawn up by one of our other awesome nurses here at Lewisburg Plastic Surgery. And I'm going to go ahead and start injecting her. And I do a specific technique. I'm going to actually pinch the skin, bring it up, move it around a little bit so she doesn't actually feel where the stick is coming from. Pinch it. I'm going to inject. Usually I do a 0.1 cc. Hold a little pressure. Let go. Any pain with that, Marianne?
Very little.
Great. Now I'm going to have her frown. Frown for me. Relax. I'm going to grab the muscle. There it is. Again, I'm going to pinch it. I'm going to go ahead and inject right there. And again, just do 0.1 cc right there. And I'm going to go to the other part of the muscle here, the tail end of it. Little pinch right here. And again, another 0.1 cc. And that's that. I'm going to hold some pressure there. And I'm going to have Marianne frown again. I'm going to grab the other muscle here, the last one. And again, I'm going to just distract her skin a tad bit and pinch it a little gently here. Give her 1 cc of an injection. And then I'm going to catch the tail end of it here. We'll pinch right there, Marianne. Last one. She feels just a little pressure as I'm injecting because that muscle I'm targeting is below another muscle. And I'm going to hold it up for her. Just kind of apply some pressure. Then I'm going to take my gauze and I'm going to hold a little pressure for her here. And she's done. How was that, Marianne?
Not bad at all.
So this is something that we do every day. 8 o'clock, 12 o'clock, 5 o'clock, anything in between. And it's usually pretty painless, pretty quick. You go back to work, and usually with our technique, with the cool pack, our little bit of pressure, we kind of eliminate any type of potential needle stick bruise. Thank you for joining us at Lewisburg Plastic Surgery.